It's on? Okay. Recurrent Studios, we're a development company that specializes in computer vision. And we have a small development team that works on mHealth solutions at home, assessing patients and collecting data so that doctors and physicians can assess patients. This is one of the examples of what we've built. We have a couple other in development. If you want to know about them, you can ask me afterwards. This is the pediatric MRI evaluation application. And I've got a video that will explain most of it with visuals. And I'll probably let that go into it, and then I'll discuss some of the specifics of it.
When a child requires an MRI scan, it's unclear whether they will be able to remain still for long enough to complete a successful scan without sedation.
And I may be talking about it after all.
General anesthesia.
There's a video file if you want to try playing that.
And drawbacks.
As we wait.
Clear whether they will be able to remain still for long enough to complete a successful scan without sedation. General anesthetic has risks and drawbacks for the child, especially repeated general anesthetic. And if a child doesn't require anesthesia, their waiting time for an MRI can be greatly reduced. Currently, the assessment of GA is based on physician and technician judgment alone. Introducing Don't Stumble Tumble, a mobile game that children play at home prior to having their MRI scan. Using the device's camera, as well as motion recognition software, the game evaluates the child's ability to lie still for extended periods of time. This information is intended to reduce unnecessary general anesthetic, improve MRI efficiency, and to reduce the stress of the MRI experience on the child. The child's progress in gameplay statistics are tracked and displayed on an online dashboard, available for the physician and technicians to view and evaluate the need for general anesthetic. Don't Stumble Tumble is beginning clinical trials at the IWK Children's Hospital in Halifax, with a goal of decreasing the use of general anesthesia for MRI, increasing patient throughput, lowering wait times, and reducing MRI costs.
So it isn't a clinical trials. Clinical trials started about 2 months ago. We've got about 50 patients that have gone through it. We should have some results after around 6 months. It is in the IWK in Halifax. There we go. Some of the other things that we're doing is right now we're actually building a version of it using the RealSense 3D depth sensing camera. And what that's allowing us to do is right now with our motion recognition tool, we're not able to get recognize any motion from within the silhouette. With the RealSense camera, we're actually able to get motion within the silhouette. So if I do this, it will negatively impact an MRI, but our tool wouldn't recognize that. With the RealSense camera, we are able to. The other thing that we're able to do is the game control now is using a sensor tag. With the RealSense camera, the game control is with your finger, which means that patients don't have to bring anything home from the hospital other than their tablet that they would already have. We are currently in discussions with an MRI manufacturer to install this into an MRI itself. The idea there is that the continuity of playing the game at home, practicing for your MRI, and then continuing that into the MRI will help reduce anxiety for children while they're within the MRI. The ultimate goal would be to put an RealSense camera, shielded obviously, within the actual MRI chamber, because right now what happens is a technician can have to ask, and they're running an exam, has to wait 30 seconds, 60 seconds, 90 seconds, even 120 seconds after an exam has taken place to determine whether the child moved or not. With a RealSense camera in there, we can give them instant feedback, real-time feedback, so that they can stop their scan, restart it, and save an enormous amount of time within the child's in the MRI itself. That's it. Any questions?
Awesome, thank you. Questions? Nathan, how'd you come up with this idea? What was the motivation?
So we spend lots of time just listening to people. And I was connected with a bunch of MRI technicians and radiologists at the local hospital, and we just listened to their problems. And we do a lot of that, where we will listen to somebody's problems, and can image recognition, can connection to the physical world actually, solve a particular problem? If it can, then we will develop it, run it through the trials, and see if we can commercialize it. And this particular one was literally 2 conversations with a group of radiologists, and they were explaining how inefficient the MRIs are with children. How many times the kids have to be rebooked with general anesthetic, how many times they have to, how many times certain kids are anesthetized, which is expensive, and it's all inefficient for the machines, and also not good for the kids.
Sure. I think any of us who are parents can automatically relate to anything that makes kids' lives better, right? So let's give it up for Nathan.